I was going to introduce you a little bit, Rachel. So Rachel
Oh,
is
all
an
right.
independent
Crack on.
Rachel is an independent consultant and a senior researcher and a parent based in Western Australia. Her research focus is on health literacy and how people with intellectual disability are supported with their health. And she is sharing her reflections on the Equally Well Match from Utrecht last year. So Rachel, you're all queued up.
Thank you, and I apologise for jumping the gun. And first, I'd just like to say Kaya, and I'm talking to you from the Whadjuk Noongar lands in Perth, and I'd like to pay my respects to elders past, present and emerging, and extend those respects to all First Nations people on the call. And I'd also like to extend my respects to all people with lived experience, both of mental illness and disability, and also the lived experience of carers of people on the call. And thank you so much for the opportunity to tell you about my experiences with the match and the GLE meeting. So first, just as a little bit of my background, Ash just said that I'm a researcher, and my focus is on people with how people with intellectual disability are supported with their health and well-being. So a large part of that does relate to health literacy of caregivers and all the different ways they support the person with respect to healthy living, accessing healthcare, making sure people receive preventative healthcare, as well as managing chronic and acute health or mental health issues. And that interest is in part driven by my lived experience as a primary carer of a young person with an intellectual disability who has also experienced various co-occurring issues that impact his health and his well-being. And for those who are interested, I've put a link to the health guide I wrote in the chat, which is just really gives you a better overview of my perspective on how we support people in a holistic way and the various roles that caregivers have in supporting that health. So I signed up for the Equally Well Match. Equally Well is an alliance who aim to improve the quality of life for people living with mental illness by providing equal access to quality healthcare. They use data to influence policymakers, they share effective resources, and they support those who are developing new programs and models of care. So why is this needed? Because unfortunately, people who have mental illness are more likely to have a reduced lifespan, and often that is from preventable conditions and not getting adequate care at the right time. So given the fact that I work in the intellectual disability space, you might be wondering why I wanted to go on a mental health match when clearly my work is in disability. But there are many parallels. People with intellectual disability die on average more than 25 years earlier than the general population. Again, this is often from preventable health conditions and not being able to access care that meets their needs. When you think about it, people with intellectual disability are often prescribed with the same psychotropic medications, although not for the mental health conditions. Those are the medications are prescribed off-label for behaviours, and the prevalence is quite high. So I felt I had a lot to learn from the Equally Well Match, particularly with respect to their successful strategies with getting all of these issues on the agenda of government. And also for how to galvanise all the people who have a stake in this, from community members, people lived experience, health services and government. The match was in London and it didn't disappoint. I gained a lot of insight from those attending, and I'd really like to particularly highlight the contribution by people with lived experience, both of mental illness and of caring for a family member with mental illness. They explored and let us know how all of that impacted their health and what we should consider when we think about preventive health care. After a busy and thought-provoking 2 days, it was onwards to Utrecht. Sadly, my luggage stayed in London for a couple of days, but I made it safely to the Netherlands. And again, there was a lot of content to stimulate the mind, but most valuable to me were actually the discussions held on the sidelines. Disability is a very broad church, and so it was those one-on-one discussions related to intellectual disability which were really important for me going forwards. I'd like to take the opportunity to put the notion of holistic healthcare for people with intellectual disability on the agenda for the Canada meeting. For this group, it's really helpful to consider both physical and mental health together with aspects of what makes a quality life, including the community participation and self-determination that our previous speaker was just talking about. While the disability, health and mental health services are often siloed, we have a lot of opportunities to think about how people with intellectual disability are adequately supported with both their physical and mental health, while still getting their social care needs met and aiming for a quality of life. Some of the ideas formulated during the match and the GLE meeting were really critical for my path forwards, and I'm super pleased to say that thanks to funding from the Department of Social Services and NDIA, I'm now working on a peer support and capacity building project with Microboards Australia. Our project has a focus on facilitation of planning for health and wellbeing for people with intellectual disability who also experience complex needs. This is where I'm bringing all those learnings together so that caregivers can support people with complex needs to have better health and wellbeing outcomes. So I'd like to say watch this space. Thank you again for the opportunity to talk to you about it.
Thank you so much, Rachel. Really appreciate your time and your reflections.